Good day, everyone. We are the researchers from the University of the Immaculate Conception from BSN 3C Group 1. And my name is ALYYSSA A. ASAMUDDIN, and my group members are Princess Samantha Cadenas, JOYCE DAPHNE COBARRUBIAS, Jazz CHERISH CAMACHO, RESLLY BLANCO, ANGELO CUEVA, and RHENA BRAGA. And we are to present our study titled Knowledge and Practice of Residents about Fire Safety and Burn Injury Management in a Barangay and Davao City.
Now for the introduction, good day everyone. Our study is titled Knowledge and Practice of Residents about Fire Safety and Burn Injury Management in a Barangay in Davao City. Burn and fire incidents continue to be a serious public health concern. According to the World Health Organization, around 180,000 people die from burns each year, mostly in low and middle income countries. In the Philippines, the Bureau of Fire Protection recorded over 16,000 fire incidents in 2023, showing an alarming increase compared to the previous years. Despite this, many people still use unsafe fire aid methods for burns, such as applying toothpaste or oil instead of running water.
Several studies have explored community awareness and practices related to fire safety. Muico et al. 2024 found that residents in Barangay San Roque, Davao de Oro had high awareness of fire safety measures but limited knowledge about post-fire response such as burn management. Similarly, Kurata et al. 2023 showed that income, education, and previous fire experience affect people's level of preparedness. Those with lower socioeconomic status were less likely to follow preventive practices. In another study, De Lalarte et al. 2024 found that grade 12 STEM students had a very high fire safety awareness and excellent practices, highlighting how regular drills can improve both knowledge and behavior. Merchado et al. 2025 also observed that BFP officers were knowledgeable about fire safety procedures but noted gaps in equipment readiness. Overall, these studies show that while awareness is generally high, practical training, proper equipment, and continuous education are essential to effective fire safety and community preparedness.
Burn injuries remain among the most serious yet preventable forms of trauma, often resulting from household fires or scalding accidents. The World Health Organization identifies burns as a leading cause of morbidity in low and middle income countries. According to James et al. 2020, most burn incidents occur in domestic environments, disproportionately affecting women and children engaged in cooking or heating activities, especially in the middle and lower income areas in the world. Similarly, Halima et al. 2024 found that while awareness of burn prevention was relatively high among adults in Saudi Arabia, many lack accurate knowledge of immediate first aid procedures, emphasizing the gap between theoretical understanding and proper application. First aid knowledge is a decisive factor improving burn outcomes. Alerto 2020 emphasized that prompt cooling of a burn with running tap water for at least 20 minutes, removing of constrictive items, and covering the wound with a clean dressing are the most effective early interventions. In contrast, El-Husseini et al. 2024 reported that 85% of respondents in their Saudi Arabian survey had poor knowledge of first aid for burns, and nearly half applied harmful home remedies such as toothpaste or oil.
So to sum up, studies show a strong link between knowledge and practice in fire safety and burn injury management. While many people are aware of safety measures, proper and consistent application remains limited due to factors such as education, income, and housing conditions. So our research highlights that prevention starts within the community through education, skills training, and active participation. Teaching residents to unplug unused appliances, store flammable materials safely, and provide correct burn first aid like using cool running water can greatly reduce risks and improve recovery. At the barangay level, assessing residents' knowledge and promoting local training programs strengthen preparedness and response. Sustainable improvement requires ongoing education, supportive policies, and collaboration among government, health workers, and residents to build a culture of safety and resilience.
This study is guided by three major theories. First is the 3RM self-care deficit nursing theory, which explains that individuals maintain their health by performing self-care. In our research, having knowledge on fire safety and burn management helps residents prevent injuries and respond properly when incidents occur. When knowledge is lacking, unsafe practices and delayed responses are more likely. Second is Nola Pender's health promotional model. This explains that people are more likely to practice health-promoting behaviors when they are motivated and believe the actions are beneficial. This means that residents are more willing to learn and apply fire safety measures when they understand their importance and feel confident in performing them. And lastly is Albert Bandura's social cognitive states that people learn through observation and interaction with their environment. In the community, residents may adopt fire safety practices by observing neighbors, barangay officials, or emergency responders. This framework shows the relationship between the level of knowledge and the level of practice of residents regarding fire safety and burn injury management. The dependent variable is the level of knowledge, which includes their educational background, training, exposure to information, and previous experiences with fire or burn incidents. Meanwhile, the dependent variable is the level of practice, which refers to how residents apply what they know, such as performing fire safety measures, giving first aid for burns, and joining community safety programs. Overall, this framework emphasizes that knowledge influences practice. The more informed residents are, the more likely they are to perform safe and effective fire safety and burn management actions.
The study seeks to answer the following questions. First, what is the socio-demographic profile of the residents in terms of age, sex, highest educational attainment, and socioeconomic status? Second, what is the level of knowledge of the residents on fire safety, prevention, preparedness and response, and burn injury management, specifically first aid and immediate care? Third, what is the level of practice of the residents in relation to fire safety measures and burn injury management? Fourth, is there a significant relationship between the residents' level of knowledge and their level of practice on fire safety and burn injury management? For the hypothesis of the study, there is no significant relationship between level of knowledge and level of practice on fire safety and burn injury management among the residents of the chosen barangay. For the hypothesis of the study, there is no significant
The significance of the study is significant because it addresses an important community concern, fire safety and burn injury management. For residents, the study will help increase their awareness of their current knowledge and practices, allowing them to improve their preparedness and response to fire incidents. For local government and barangay officials, the findings can serve as a guideline in creating or strengthening fire safety programs, training, and health campaigns to improve and promote a safer community. For health professionals and emergency responders, the study provides insights into the community's needs and knowledge gaps, helping them design a more effective health education and first aid interventions. For nursing students, the research allows the application of theoretical knowledge in real community setting, enhancing their skills in health teaching and emergency preparedness. Lastly, for future researchers, the study can serve as a baseline data for reference for future studies related to disaster preparedness, injury prevention, and community health education. Overall, this research aims to support collective efforts in building a well-informed, fire-safe community.
So this study uses a quantitative descriptive correlational design to assess the relationship between residents' knowledge and practice on fire safety and burn management in Davao City. So it identifies patterns and gaps to guide community programs that enhance preparedness and proper first aid.
In our study, we use purposive sampling, a non-probability method to select residents of Barangay 5A Davao City based on specific criteria, ensuring participants have relevant knowledge and experience in fire safety and burn injury management. The target sample size is 150 to 200 residents, which is sufficient for quantitative analysis and aligns with Bujang et al. 2024, who recommend a minimum of 149 participants for reliable correlation analysis. To further justify our sample size, we use Cochrane formula as a statistical reference. This formula is widely used to determine the ideal sample size in large population and ensure that the chosen sample is representative of the population. The formula is follows as where n is the sample size, z is the z-value for 1.6 for 95% confidence level, P and Q is the estimated proportion of the population, and the E is the margin of error. Using this computation, the initial sample size was 384 for an infinite population. Since our population is finite, a total of 7,172 residents, we applied the finite population correction formula, which resulted in an adjusted sample size of approximately 365 respondents. However, we decided to limit our target to 200 respondents. This table shows the distribution of our respondent according to age group.
For the respondents, we selected permanent residents of the barangay aged 18 years old and above who have lived in the area for at least 6 months. We used purposive sampling to ensure participants meet these criteria with a target of 200 respondents. The research setting is an urban barangay in Davao City, specifically in Barangay 5A, characterized by closely built houses and busy community areas. These features increase the fire risk, making it an appropriate location for assessing fire safety knowledge and practices.
So the research instrument, the main tool used in our study is a structured survey questionnaire developed by the researchers. It was based on relevant literature and previous studies related to fire safety and burn injury management. The questionnaire has 3 parts. The first part focuses on the demographic profile of the respondents. The second part measures their knowledge on fire safety preparedness and burn first aid using a 4-point Likert scale. And the third part evaluates their actual practices on fire safety and burn management using the same scale.
For the data gathering procedure, the researchers will begin by securing approvals from the Dean of the College of Nursing, the Human Resource Management Office, and the barangay captain of the selected barangay in Davao City. After obtaining permission, participants will be oriented about the study's purpose, assured of confidentiality, and asked to sign an informed consent form. A structured and validated questionnaire will be used as the main data gathering tool, consisting of 3 parts: the demographic profile, knowledge of fire safety and burn management, and actual practices. The questionnaires will be personally distributed to households, with interviews conducted. After collection, responses will be checked for completeness, encoded, and double-checked for accuracy before statistical analysis. This ensures the reliability and validity of the gathered data.
For the statistics tools, this study used both descriptive and inferential statistics to analyze the data from selected barangay in Davao City. Descriptive statistics like frequency and percentage describe the respondent profile, while the mean and standard deviation measure their level of knowledge and practice. And for inferential analysis, the Pearson correlation determine the relationship between knowledge and practice in fire safety and burn management.
This study focuses on examining the knowledge and practice of residents regarding fire safety and burn injury management in a barangay in Davao City. Specifically, it covers aspects of fire prevention, preparedness and response, as well as first aid and immediate care for burn injuries. The study will be conducted in a chosen barangay in Davao City. The respondents are residents who have lived in the barangay for at least 6 months, regardless of sex or educational attainment, and who are 18 years old and above. A non-probability sampling method will be utilized, targeting a minimum of 200 respondents with an additional 10% for non-responses and 30 respondents for pilot testing, bringing the total to approximately 250 participants. The study is limited to the selected barangay and does not aim to generalize findings to other areas. It focuses on fire prevention, preparedness, and response, excluding other areas such as post-fire recovery or fire investigation procedures. Respondents are based on self-reported data, which may be affected by recall bias or social desirability. Additionally, the study also considers selected demographic factors such as economic status, highest educational attainment, and previous fire experience, as these may influence the respondents' level of knowledge and practice.
For the ethical consideration, before conducting the study, we will first obtain approval from the College of Nursing and permission from the barangay captain of the selected community in Davao City. The research will strictly adhere the Philippine Nursing Code of Ethics 2019, Republic Act No. 9173, ensuring that the rights, dignity, and well-being of all participants are protected. Participants will be fully informed about the study's purpose, procedures, and their roles in it. Their participation will be voluntary, and written informed consent will be obtained before data collection. Confidentiality and anonymity will be strictly maintained, and all gathered information will be solely used for academic purpose. Throughout the study, the ethical principles for respect for persons, beneficence, and justice will be observed to ensure fairness and prevent any form of harm to the participants.